Hello, everyone. Welcome to the ISRT COVID-19 webinar for today. This is episode for the COVID-19 series. I know that everyone would love to see your representative from your societies and your friends from across the world sharing the experience. The title of Radiographers, Are We Really Frontliners During the COVID-19 Pandemic? And this is very, very important because we got this question and comment from our audience during the first two episodes. And some of us got struggled because of uh, the way we work as the team approach. And then sometimes we don't get what we want because we are not considered as a frontliner. For example, the PPE, the suitable mask to wear when we service the patient and things like that. And I have to say good morning, Americas. Good afternoon, Europe and Africa. And good evening, Asia and Australasia. This is Napapong again, your host. I'm the Vice President of ISRT for Asia and Australasia. And today we have four speakers representing our three regions and four sub-regions. The first speaker is a very, very nice guy. He's my good friend and one of the board member, Philippe Jassong. He is the ISRT treasurer. Philippe is from France and he is really frontline. He works in a hospital. And the next speaker is from the Americas, Reshma Mahipat from the Society of Radiographers of the Trinidad and Tobago. And from Asia and Australasia, we have Pichi Luna from Philippines Association of Radiologic Technologists. And of course, we have one from Africa. We have Hilashni Rungasamy, and she's a senior radiographer and clinical tutor at Capital Radiology in Pretoria from South Africa. And we have two more important persons to be our panelists tonight. We have Stuart Whitley. Stuart is the ISRT Director of Professional Practice because tonight he's going to show us about the draft position statement about this frontliner status to everyone after we have the speakers give the talk already. And one more important person who is coming to join us tonight is Ashni Ramkaliwan. She is the President of South African Society. Well, since we have quite limited of time and people may need to have your own breakfast or something in the morning, let's start with Philippe Jassong, and he is going to do his presentation about the view from France.
Just to introduce me, I'm Philippe Gerson from France, Vice President of the French Society, ISSRT Treasurer, and I'm a chief radiographer in a big hospital in Paris in a center, and otherwise I manage two radiology department in another hospital with a big pediatric unit and another one with urology. So today we are the COVID in France, and 30,000 around people died. So it was terrible, but we have to manage the situation, and I want to explain you how we proceed, especially the situation management. I'm chief radiographer. So first I will start with a jump into the unknown and a white plan and a similar situation. Why I told you jump into the unknown? It's a leap into the unknown because we have never managed an epidemic situation, except the doctors who worked in Africa on Ebola, for example. But it's a pandemic and not an epidemic. I'm very involved in Africa since a lot of years, so I know how the people proceed in Africa, but it's totally different with this new pandemic. I just want to show you this slide about the cause of death worldwide are much more important for cancer, infectious disease, road accident, suicide, but the unknown and the lack of treatment has caused worldwide panic. When somebody a doctor tell you that you have a cancer, we know it's going to be a long way, fatal or not, but there are therapeutic perspective. For the COVID, we know nothing or know much, even if the Chinese doctor immediately transmit all the relevant information. So the unknown, we don't know what we are going to do with this disease. The alcohol, cancer, tobacco car accident kill much more than COVID, but are not transmitted. COVID is, but we know that AIDS is sexually transmitted. I live as radiographer at the beginning of AIDS in the 90s. We did not know this disease was transmitted, but we knew that the homosexual community was very affected. And very quickly, we knew that it was a sexually transmitted disease. For COVID, we do not know yet how contamination is done. We suppose, but we don't know. That's why I want to translate the slide, which is in French. It said, "Oh my God, general alert! Stop the world! We are going to death hall." So, white plan. Well, in France, we call white plan when we have a situation in emergency that with a simultaneous mobilization of a police force, firefighters, hospital, 24/7. This plan is triggered for major disasters such as serious accident, terrorist attack, natural phenomena like floods, earthquake, or something like that. We don't have earthquakes in France, but we have floods. So when the state decide to have the white plan, you have to be you're on work like 24 hours and 7 days, so you can be at your hospital. The white plan was launched on March 14 and has just ended the last week. It corresponds to the lockdown and after it. As a chief radiographer, I experienced similar situation as chief radiographer during the terrorist attack in 1995 and 2015 in Paris. It's a leap into the unknown. You don't know if there will be other attacks, and you must ensure the management of the crisis, but eventually prepare yourself for another one. These are different white plan situations, but also with similarities. You are asked to be efficient, fast, and make the right decision for your staff. The important thing is the situation is to remain calm and to transmit calm and serenity to your staff. Of course, the administration of the hospital, the medical doctor help you and transmit information to you, but at present this is often too much information and it is necessary to know how to sort to go to the useful. Situation management and the staff management, which is very important. As for the terrorist attack, the staff mobilize themselves for the disaster situation. Everyone wants to help and participate, but it's necessary that the staff understand that the situation will be able to last and that the disease can strike them all if they are all together at the same time in the department, and therefore there will be no one left of take care of the pet. It was necessary to plan the teams by making them take turns, and that for the nurses, but also for the radiographers. It's very important to make clear, and it was not obvious at the beginning. Architectural organization and circuit. Patient organization and circuit in the radiology department is very important. There must be a circuit for COVID or suspect COVID and another for other patients. It is much simple for large departments that can dedicate equipment such as X-ray radio, CT scan, and ultrasound equipment for COVID. For others, a patient circuit must be created and validated by the agent team. I compare with the different hospitals in Paris. We have a hospital who have several CT scans, so it was easier to dedicate one CT scan for the COVID because you know that CT scan is very important. And for the others, it was like in my department, we only have one CT scan, one MRI, so it was much more difficult. Hygiene is very important, so we have some system to clean the MRI, for example, the CT scan. So we did that, and we continue to do that. Personal protection equipment, we call PPE. I've been a subject of controversy in France, especially for masks, where there has been a shortage, but not for hospital. Overall, the hospital and the radiology department have had the necessary equipment to work. The most difficult has been for nursing homes, caring for the old people. And we know the pandemic has hit our elders very strongly. Of course, training has taken to place to teach staff how to use a PPE effectively. In France, it's probably the same. Most than 70% or 80% of people died were under 75 years old. Activity. Imaging department has been completely changed. The operating theaters, the consultation closed, all activity has focused on COVID. Most part of the private radiology department were closed. Most of the activity has been concentrated in the hospital. It's very impressive to see the hospital empty in some part and full of the COVID sectors. My hospital in the center of Paris is close to Notre Dame Cathedral. It was the first. Usually 6 million tourists come per year with nobody in Paris. Paris was a ghost town. In my hospital, we also have an emergency department that we close and replace by the PCR screening center. The sector receives up to 250 people per day. Of course, with a special circuit and entire organization for monitoring patients. Radiologists work in this center. Sometimes patient arrives with cough and fatigue or passed directly to the CT scan, which is faster than PCR in the diagnosis of COVID. Radiographers' role. We quickly learned that radiographers were going to play an important role, especially for bed patients, X-ray and CT. Some people had the disease, but overall they were very little affected because they protected themselves very well. Just before the COVID crisis, there have been demand and strikes to improve working conditions and especially wage. The government has heard the demand of health professionals and exceptional bonus of 1,500 euro has been given to all healthcare professionals who participate in this crisis. Negotiations have started and we hope to raise the wage by 300 euro per month. Radiographers are very rarely on strike in France, but faced with lack of staff, the necessary saving made at the hospital, and the growing demand for imaging examination, the COVID was, as we say in France, the drop of water that made the vase overflow. CT has proven in all countries of the world as the fastest and most effective examination. I will not come back to this point, which has been presented everywhere. Use a CT scan in a country with a special COVID unit. It was in the east of Paris at the Henri Mondor Hospital. As we can see, the radiographer has been at the front because this funding is like a war, and the radiographer have been like health soldiers. In the screening center, I told you about in other centers, many patients were able to benefit from a chest ultrasound in search of an effusion. This study is very interesting but dangerous for the participant. Usually it's a medical doctor, a radiologist. The CT scan has definitely shown its superiority. For equipment, it was necessary to urgently order mobile X-ray for bed patients and ultrasound for intensive care department. Association's role very important. The French Association, AFPPE, has an important role in passing information to all radiographers via social networks. It supported professionals and in their requests. The European Association, IFRS, organized a webinar very quickly at European level. The ISA, which is an old association, reacted very quickly to the request of WHO, which immediately saw the important role of radiographer in the diagnostic and treatment of COVID patients. On its website for the radiographer, healthcare worker on the front line. The FAS webinar on March 20. And here's a document published in emergency by the ISSRT with WHO. In less than 15 days, this document was produced, validated by our board. It is complete and was widely used worldwide as a reference manual for radiographers facing COVID. Webinars have been proposed around the world, and as here for Asia with our colleague from Thailand, Myanmar, Hong Kong, Vietnam, Japan, Korea, Philippines. These Facebook webinars were attended by thousands of professional radiographers and healthcare workers worldwide. There were some on the CT scan from Greece and others with the USA, Canada, and other countries. Many are in preparation for the next few weeks, and we will see them on social media. We have to react it very quickly and made some good decision and some wrong as well, because it's difficult to be in a hurry. We are all volunteers. COVID has accelerated through webinars. It's a very good thing, but it does not replace conference and workshop where radiographer meet face to face. We have unfortunately postponed our ISSRT World Congress to August 2021. I hope you will be there and that COVID will be far behind us, and that we'll be able to drink a good Irish beer all together or to shake hands. I thank you very much and I hope to see you in Dublin in 2021.
Thank you, Philip, for your presentation, and it's very comprehensive. And I know that you're on vacation right now, but you're going to join us for the Q&A session. We have the next speaker from the America region, our good friend Reshma Mahipat, and she's from the Society of Radiographers of Trinidad and Tobago. Turn, Reshma.
Thank you for the opportunity to participate in this, the third Facebook Live session of the ISSRT. Greetings, everyone. I am of the Society of Radiographers of Trinidad and Tobago. First, a few facts. Trinidad and Tobago is a twin island state in the southeast end of the Caribbean. Our population is 1 million people. The climate is tropical, and ours is a vibrant, colorful people. The Society of Radiographers of Trinidad and Tobago is the educational wing of the local radiographic fraternity, and has pursued its role in the provision of relevant articles and e-learning resources that were made available through organizations like the ISSRT and the European Society of Radiology. We are available to our members for feedback about concerns and provided guidelines when needed. It was our pleasure to host the 20th ISSRT World Congress in 2018. It is that we socialized freely in the not-so-distant past. But now, on to more sober matters. Our world is experiencing the worst pandemic in recent times. The reach of this pandemic is extensive, and Trinidad and Tobago was no exception. On March 12, 2020, Trinidad and Tobago recorded its first COVID-19 case. The Trinidad and Tobago government made the decision to immediately close schools on the 13th of March. Subsequently, all non-essential borders were closed by the 31st of March 2020. At present, the Trinidad and Tobago COVID-19 statistics are as follows. Number of positive cases, 123. Number of deaths, 8. Number of discharged patients, 109. Number of active cases, 6. The majority of cases were imported, and all incoming travelers were immediately quarantined, which is what has attributed to the low figures. As such, effective the 22nd of June 2020, the cautious resumption of normal activities in public spaces, adopting the new normal, was instituted by the Trinidad and Tobago government while maintaining closed borders. The response of the government of Trinidad and Tobago was to implement policies to ensure limited physical interactions in order to reduce the spread of the virus. These included a stay-at-home request, where only if you were an essential worker or if it was absolutely necessary for you to venture outside to purchase food or to seek medical attention, you were to stay indoors. And if it is you had to come out, you had to be wearing a mask. Social or physical distancing, you were minimizing physical contact with other individuals by maintaining a safe distance of 3 feet whenever possible. Practicing proper hand hygiene using soap and water with the correct hand washing technique, or using alcohol-based sanitizer. And a COVID-19 hotline was set up and it was used for general information and medical advice as it pertains to COVID-19, and also to schedule home visit testing. Hospitals, extensive training in infection prevention and control techniques were conducted. Infrastructure for additional hand hygiene stations were added throughout the hospital, along with an extensive sign campaign to wash hands, wear masks, maintain social or physical distance, and to minimize physical contact. Provision of personal protective equipment, or PPE, was a major concern initially, as most of the suppliers were in regions that required their stores. Our stocks locally were strategically distributed with priority to COVID quarantine centers and emergency departments. It proved adequate. Now, although limited, PPE was always available to radiographers for the performance of their duty. As part of the COVID-19 response, radiology departments developed specific protocols for patient interaction in imaging exams. These included rerouting of patients entering the department who displayed flu-like symptoms, ensuring proper use of masks, and good hand hygiene. In addition, there was modification of workflows and maintenance of good IPC practices. As expected, and these are just a few, the government of Trinidad and Tobago initiated a parallel healthcare system designated for respiratory illness so that a measure of isolation for patients with non-respiratory ailments could be afforded. This was done using human resources and consumables that were in existence, which stretch resources. Annual leave for healthcare workers was suspended to increase the workforce to cover both systems. Having to cover emergency cases and suspected COVID-19 cases had stretched our human resources, with many radiographers having expressed feelings of burnout. Considered frontline in all instances, but were treated with on an as-needs basis. At the health centers, their screening protocols for suspected COVID cases would guide patients to the tertiary center for imaging, which was equipped to handle them. As such, radiographers at the health centers did not have PPE as readily available as other imaging departments. On the other hand, there was no dearth in supply at the tertiary institutions that housed the COVID-positive patients. Priority to PPE supply to radiographers thus varied according to the designation of the institution they were at. In most institutions, an IPC nurse was in charge of PPE distribution. However, all radiology departments were allotted their PPE. Communication from management proved a challenge in certain instances. Portable x-rays for suspected COVID-19 patients were done in makeshift isolation areas within the emergency department. The department was regularly sanitized, and depending on the patient's housing and isolation needs, the areas were moved to decrease dose to bed-bound patients. A significant challenge was that radiographers were not being informed about these changes as a matter of priority. Due to the dynamic, it was our duty to find out the changes and work with nurses to locate patients to facilitate the portable imaging study. Good communication with the healthcare team was a necessity. So, looking at the way forward, it is heartbreaking that even during a pandemic, when radiographers were most present and played an active role in the diagnosis, treatment, and recovery of citizens, radiographers are not widely deemed frontline workers. Now is the time for us to focus on gaining better recognition for our profession by raising awareness of our roles, responsibilities, and importance to medicine. This can be done through career day activities, published articles, and use of the social media platform. Another strategy would be to have radiographer representatives as an advisor to the Ministry of Health in a not too distant future so as to represent and advocate for better working conditions and benefits for radiographers. Also, the creation of a labor union specific to radiographers can be another way forward. The reclassification of the profession to reflect the educational requirements and skill sets of radiographers may also prove beneficial. Now, as to the role of radiographers as frontliners, radiography is the eyes of medicine. It is through radiological services physicians are able to see what pathology is there and to what extent it exists in the individual. During this pandemic, the humble chest X-ray has been instrumental as an immediate answer as to how a patient is to be isolated and the planning process for the patient's prognosis. Results from a COVID-19 swab test in Trinidad takes approximately 24 hours, so patient treatment can begin while waiting for results. In the X-ray, it could be further demonstrated with CT. Follow-up with patients on wards or in clinics post-discharge from the hospital would map the patient's improvement or monitor the pathological process as treatment is administered. The role of radiographers has always placed us in the trenches in emergency rooms for critical patients, in the theater for emergency surgical procedures, in the ICU to assess line placements and desaturations. Consider all these scenarios with the addition of the possibility of COVID-19. We are the front line. We are part of the team that can save lives, and we are there to ensure that they can see what they are dealing with and take the guesswork out of medicine. That is the end of my presentation. Thank you for your time, everyone.
All right, thank you so much, Reshma. This is very important message that you give to our audience, and we will come back to you for the Q&A session. And for now, I would like to move to Asia, Australasia region. We have my good friend here, Pichi Luna, from the Philippines. Pichi Luna is from the Philippine Association of Radiologic Tech member, and they always have the good contribution to the ISSRT. And today, Pichi will represent her organization presenting about this topic on radiographers. Are we really frontliner during the COVID-19 pandemic? Please go ahead, Pichi.
Hi everyone, greetings from the Philippines. I am grateful to the ISSRT International Society of Radiographers and Radiology Technologists for inviting me to speak for the Philippines as part of Asia Australasia region in the ISSRT. I will discuss about the experiences and situation of radiographers and radiologic technologists as frontliners in the Philippines during the COVID-19 pandemic. Allow me first to introduce my country, the beautiful Philippines. The Philippines is one of the world's largest archipelago nations. It is situated in Southeast Asia in the Western Pacific Ocean. Its islands are classified into three main geographical areas. We call them Luzon, Visayas, and Mindanao. The two largest islands, Luzon and Mindanao, make up the 2/3 of the total land area. Only about 1/3 of the islands are inhabited. As a large archipelago, the Philippines is a culturally diverse country. For the current situation of COVID-19 pandemic in the Philippines, the Department of Health reported that the total number of coronavirus cases in the Philippines has reached more than 31,000. And though the DOH recording now 1,000 new cases each day, there is increasing number of new recoveries, bringing the total tally to more than 8,000. And most cases with more than 60% are large and developed cities like Quezon City, Manila, Makati, and Caloocan. In the ASEAN region, the Philippines consistently ranked third for 2 consecutive months now since April 22, 2020 to the present. With over 2,600 infected healthcare workers who have COVID-19, the 5 medical professions with the highest number of
and the COVID, there were a couple of challenges that arose due to panic buying by people who didn't need it, which was just the general public that thought, they needed to get the masks and the gloves and whatnot. Obviously leaving very little stock for the people who actually needed it. And also the fact that the ports were closed, so no stock could be imported. Our hospital ran out of PPE. And this is where Dr. Fellerman stepped in and said that he'd assist as the radiology department had stock. So this act of kindness, so we noticed positive changes all around in the hospital towards us. The communication between myself as head of the department and the head of the A&E department, and also between myself and the wards and ICUs, had improved tenfold after this. And also, the respect filtered down to my entire team of radiographers, which made our working relationship much better. It was very welcomed in such a difficult, scary time in everybody's lives. So we at Capital Radiology have been recognized as frontline workers in our hospital by the affiliated staff and by hospital management. Dr. Fellerman is an active member of the MAT meetings. I've spoken to him on numerous times where I've brought suggestions up to him and he's taken it up to these meetings, and they didn't just dismiss it. It was taken into consideration. Changes were made according to these suggestions. So here in our hospital, we have really been seen as part of the frontline team. Unfortunately, not all the radiographers share the same privilege that we do. I've spoken to colleagues at other private institutions here in Pretoria. Out of people in 9 different practices that I spoke to, only 4 practices actually recognized the radiographers as part of the frontline team. One of the practices, the radiographers said that initially they were not seen as anything with regards to frontline, and once they sort of brought up their concerns and view on this, and then they were actually treated as part of the frontline team, given PPE and assisted with possible COVID patients, the POIs, the positive patients. I managed to speak to 4 colleagues that work in the government department, and it is shocking. They are not recognized as frontline workers at all. The doctors and nurses are given the PPE, the radiographers are not. The radiographers are not. They are still fighting the struggle. We are now 3 months into it every day. So it's unfortunate that this now doesn't take us very much further from the starting line with regards to radiographers all over the country. Like I say, I can speak for myself and my practice. We are frontline workers. But yeah, it is sad that the rest of the people do not get seen as frontline workers. I just want to say thank you once again for the opportunity to present at this webinar.
Hi, I'm sorry. We have now finished the talk from Theology, and thanks again for your presentation. At the moment, we have sub-region of ISSRT finished the talk that kind of represents our voice from across the world. What I heard was pretty much the same story about the PPE. That's the problem, because at first of the pandemic, the frontliners of the healthcare team to deal with, and then I see different countries deal with this situation in different approach, and I think it depends on your infrastructure and how many radiographers practicing in your place also. Before we take some questions from the audience, I would like to introduce one of the panelists today. We are honored to have the panelists representing from our member society from South Africa. We have Ashley Ram Kelawan and African Society. Well, Ashley, welcome to the show. And then I would like to thanks again for the South African Society for your contribution to a lot of work with our organization. I would like to have the first question to you. As representing the profession in your country in South Africa, I know that the pandemic has been around for quite some time. I just want to know that, well, I know that you guys have problem about the PPE, the recognition as a frontliner. I want the African Society of Radiographers.
All over the country. Like I say, I can speak for myself and my studies. We
All right, I think Ashley microphone has some problems here, and I think we will notify to her and then let her speak again. And I think now we want to come back to our first speaker. Philip, are you there?
Is that okay?
Yeah.
Can
Are
you hear
you
me?
there? Yeah, I just want to get the comments from your presentation. I know that France got hard hit on this pandemic, and then I want to hear from you and what your experience was like when you deal with this situation where you don't have enough PPE because somehow the hospital did not really recognize radiographers as the frontliners of the dealing with this. And what your experience was like.
I'm sorry, because it's difficult to hear your different people speaking at the same time. So, about the PPE in France, we had a big problem with that, and thanks to people, we can have some from China, and we can import them, but they come too late. But it was not dramatic in the hospital. It was good. We can have the PPE, not enough, but we can have, especially for the radiographer.
All right. Oh, very good. And I think I come back to Reshma from Trinidad and Tobago. I got some of the keyword from you in terms of how to get recognition to be frontliner. You talk about the reclassification of the profession in the government system, and you talk about labor union if it is possible. I just want you to elaborate a little bit so that our colleagues from around the world will hear what you say again.
Okay. Thank you, Napapong. What I was speaking to is the fact that right now Trinidad and Tobago does not have a exclusive labor union that represents radiographers. We are part of the public sector and we are represented as such. It's the thought of many of the radiographers that maybe if we have somebody at the ministerial level speaking to the needs of radiographers and clarifying issues that may relate to radiographers or affect radiographers, that they would effect a positive change where we would not only be represented, but it would be beneficial towards our main focus, which is the patient. So it would benefit the patient primarily. About the reclassification, though, most of our legislation is based historically. We are in the process of updating, but most of our legislation speaks to radiographers being holders of diplomas, and they will not really reflect the educational requirements that are currently being met. Now we are all Bachelor of Science degrees in radiological sciences, and I thought that maybe if it was more spoken to and shown that we are not just there to push a button, we are well qualified, we have a substantive syllabus that we are taught, that maybe that would garner some respect, that we would be beneficial for us later down.
All right, that's a very good idea, because I think in back home also we found the problem not only when we have to face the first wave of the pandemic, we didn't have really enough the PPE, but our education and training in terms of infection control is very important too in this kind of situation. I want to go back to the Philippines, Peachy. You mentioned about, well, I know that your country is doing very well in terms of like certification licensing, and now you have a very strong CME system in your place. But when we look back at this situation, but really you are still not struggle, you are still facing with this COVID situation, as you can see from the number of infected patients per day increasing in the Philippines. So what have you done so far so that you take care of this problem, like you don't have enough PPE because you are not recognized as a frontliner and things like that?
So as I have mentioned, since the Southeast Asian live session too, we have chapter associations that have made their way in supporting by providing some PPEs to member RADTECs and nearby RADTECs who are working in areas that are near to the chapters. There is really a limitation on how we mobilize our association, especially because the national organization is situated in the center of Manila, where we have very much high incidence of COVID-19 cases. And it's good that we have very good active chapters who are very much willing to donate, provide fundings to purchase their own PPEs to be able to supply to our members.
Oh, that's a very good idea also, and I think a lot of people can learn from you and your experience. I wanted to go back to Theolosny from South Africa. I know that you work in a private practice, and things may be different, but I think people who also work in a private practice want to learn from you also, and on how you deal with this kind of situation, because a lot of people might have thought that private sectors, they might have enough resources to provide. But sometimes, even back home, we got struggle also in the private practice, because the hospital management may not recognize us radiographer as a frontliner. So in terms of distribution of the PPE and those masks that is necessary for our practice may be limited. Please let us know what have you done, not only in your hospital, but other hospital in a similar kind of practice in your country. Yasni, are you with me?
Hi, can you hear me?
Oh yeah, sure. Maybe a little bit delay. Yeah, just go ahead.
All right. So, yeah, like I said, the way it works with us is we are normally a private radiology practice within a private hospital. So all our equipment and consumables are seen to by our partners, and that's the way it works with most of the private radiology practices. So basically, radiology rents a space within the hospital. So hospital management has got nothing to do with our provision of PPE. And I think that is why we normally have such good stock, and we don't need to rely on hospital management for PPE because our doctors provide it for us. Yeah.
Oh, that's very good idea. I think this kind of practice happen in many places also, where the private sector has the collaboration with the hospital to provide radiology service.
Yes.
I think I would try to go back to Ashley. Ashley, do you hear me? Can you try to say something? I'm not sure how it works for your microphone at the moment. Ashley, you hear me? All right, maybe let's figure out later for the president of the South African Society. Let me go back to our international organization, Stuart Whitley. Stuart is with us today, and from this kind of response from our member. All right, maybe let's figure out later for the president of the South African Society. Let me go back. Stuart, are you with me? From this kind of response from our member. All right, maybe let's figure out later for the president of the South African. All right, I think I have. Let me go back. I think I have Stuart Whitley with me, and then
Hello.
Stuart. Hi. Well, technical challenge a bit today, not because of the COVID, but maybe the time zone. Stuart, the Director of Professional Practice from ISSRT, we have drafted the position statement on this based on the request from the member societies, and I would like Stuart to show us today about this. Please go ahead.
Sorry, Nakapong, I had killed the sign, so can you repeat what you said, please? And
all right. Well, I just mentioned that we have a lot of responses from our member society about if we have any document that we are frontliners in this COVID pandemic, so that they can use this document to deal with the management or the government to prove that we really are in terms of international practice. And as ISSRT, we are a representative, international representative of the profession. And Stuart Whitley, you as the Director of Professional Practice, really we have drafted a document, and I would like you to talk about that.
okay, Nakapong. I'm very pleased to show this position statement, which has just been adopted by the ISSRT board. Hopefully everybody can see it, and this position statement was put together thanks very much for the input of many radiographers and radiological technologists across the world. And to put things into context, the WHO have produced a rapid guide document on chest imaging related to COVID-19, and in it states quite categorically that all imaging workers, all those involved in imaging, are frontline workers. So please go to the document at WHO, which we hopefully will put up soon. But and we give a reference. We give the rationale in this document, and also the background and some excellent references, and more importantly, the type of aspects that employers should provide for frontline workers. We haven't mentioned radiation therapy radiographers. They're also included as frontline workers, as well as diagnostic radiographers. We all know that we are frontline workers, but from what I've heard today, it's sad to hear that certain levels of the healthcare system don't believe that to be true. So this document quite clearly sets out the reasons why we are, and why those employers who take us on, because we are in the very heart of the patient pathway. Without radiographers and radiological technologists, as we all know, the images which portray what's happening to the patient will not be obtained, and additionally those undertaking radiotherapy procedures, the patients will not be treated. So I'm very pleased to say this document is available, giving that a nice background, giving wonderful, fantastic links. And most of these links that you'll see are straight off the press, with most member organizations providing them, giving absolutely fantastic resources. But those WHO are key references to point your employer to the importance of radiographers in the front line. Oops.
All right, this is very comprehensive document, and we sure will distribute to the council, right, to prove it.
Is there anything else, Napapong, I should say?
Thank you, Stuart. Basically, this document will go through to the council, right, to prove it? Or what's the process right now?
Well, at the moment, this was circulated to all council members. It was first drafted and sent out to a small group, after which we have circulated to all council members throughout the world. And based on their feedback, we have this document which the board has approved, which council will see again in Dublin. Quite interesting. Some of the feedback which we got, especially from some of the African members, was extremely important. Even access to a water supply, so that people can actually wash their hands. Some of the things which we sort of take for granted in some countries. And I think it's important to put that in, so that no matter how small or big the institution is, or how small or big the country is economically, the very basics are essential to ensure a standard of health. The other interesting thing is that whilst this is COVID related, it's the COVID pandemic which is focused on the fact that we are frontline workers, not just because of this particular pandemic, but we are frontline workers per se in all aspects. And so employers must provide us with the resources and the help and support for radiographers on the front line, making sure that they have a good health surveillance going on in the background as well, and support for radiographers and technologists if and when they contract any disease or accident at work.
Oh, very, very interesting. So for our members around the world, you will sure see this document, right? We already circulate the document to other countries. And I tried to go back to Ashley, the president of South African Society again. And do you hear me, Ashley? Quite technical challenge today. This is really the last episode of this COVID-19 already, and I think maybe we have the speaker just have a say to finalize this episode. Like, what do you want to see in the future? As our status as a frontliner, we know that we get struggle. What we want to see, and how can we reach that situation or that stage of the frontliner really in practice? Let me go to Peachy first. Peachy, unmute your microphone first.
Yeah, I think COVID-19 has given us so much challenges that we must consider these challenges as an opening to more opportunities. Through this, we were able to connect among each other, share our best practices and experiences and even challenges that were posted on us. I think that to be more recognized as frontliners, we must, as radiographers and radiologic technologists, take much part of our roles, not only to perform radiological examinations, but take much part in educating the many people in our community. It's not only just providing the services to patients, but be the frontliner in disseminating information about the roles that we do, the high impact responsibility that we perform, and the high roles that we commit to ourselves to be able to help in the global health. So I think more RadTech should be at the front line of providing the effort to make sure that our roles are being recognized. And we should not be thinking about the second in line. So it's not only by performing procedures, but we can be at the front line of providing education to the people and also providing them the service that may be warranted because of pandemics such as COVID-19. So we must always see opportunity in every crisis.
Yeah, that's a great thing to say. Reshma, what do you think in this?
I'll have to agree with Peachy. We have a lot to, we have to use the circumstances that we're in right now to pretty much map our way forward. I think that education to the community, where we embark on maybe a widespread campaign that would inform more people so the average person is aware of the services that are provided by radiographers, and it's not just a doctor, nurse, hospital-run sort of institution. It could prove beneficial also. Long-term, though, maybe we could embark on a historical sort of perspective for the larger societies, sort of mapping how it is they've achieved the legislation and their structure on the development of their society itself, so that, you know, it's developed, you know, a way forward for smaller societies to kind of grow and, you know, impact radiography a little bit better, firstly starting with themselves, you know?
Yeah, of course, the world is big, but as long as we are friends, we collaborate and we can move ahead together. This is what I really think. And go back to Philippe. Philippe, are you with us before you go back to your vacation? I just want you to say something as from France, a very big society in Europe.
Yes, just want to say that I'm optimistic because for the first time, as you know, many journalists they speak about the CT scan, which was the best exam for COVID. So 2 times they start the news at 8 o'clock, which is a big audience in France, with 2 reports about the radiographer. It was the first time, and they explained our job. So we are very proud that we speak about our job. Usually, they always speak about the medical doctors and nurses and never the radiographer. For the first time, we had some information, and they explained what the radiographer is doing in the hospital. So, I hope it will be the same for the future. Also, what is very important that we have a link with, thanks to the ISSRT, that we have links with other countries, and we can share the experience and take some good ideas from overseas. So I think which is the best for the future, that we are the big family in ISSRT, but with all radiographers from all over the world.
All right, very good thought from you, Philippe, and I hope you enjoy your holiday.
Yes, I can show you where I am. It's fantastic. I'm in front of the beach, but you know, even on my holidays, I'm proud to be a radiographer.
Oh, good. Very, very good. And let's go back to Osni. Are you still with us? I just want you to say something to the audience from your experience, how we can proceed to the future about this frontliner status. Dilashni, are you with us?
Hi.
Hello, are you there?
Yeah, I'm here. I'm here. Can you hear me?
All right, I just want you to say something to the audience about how would we proceed to the future about our status, how hard work we have to do to achieve that stage of the profession.
You know, that's a good question. We are just going to have to keep our stand firm. If we get a patient that comes in through A&E, the first two people they call is bloods and X-rays, and we're going to somehow have to keep on making ourselves known to say, listen, you've called me as part of the first team to work with the patient. So yes, I am a frontline worker. Whether you recognize it or not, I am standing here and I am a frontline worker. Like I say, here with us, we've got it right in this hospital, but for my colleagues in government, it's really difficult. And they're just going to have to keep fighting that fight and making it known that I am a frontline worker and this is how it stands.
All right. Very good thought. You know, this is reality when patients come in, blood and X-rays, right?
Always.
Maybe we switch to X-rays, then blood, then we are first liner. All right.
Yes.
All right, we can try to go back to Ashley again and hope she can hear what we say. Ashley, do you hear us at the moment? Actually, we have a lot of contribution from the South African Society so far in various ISSRT projects. When we sent to the South African Society, they gave us feedback and they work with us in many important documents so far. So I think today is so unfortunate we have technical difficulty with the president, but we really thank for your time, Ashley, that you come in to join us. And I hope we're gonna fix this challenge, all right? Technical challenge, not the COVID challenge, because this is the last episode of the COVID-19. We're gonna get back to you and bring you back. We will tutor you on how to use this Zoom. I know that there's gonna be some challenge anyway, but well, I think it's time for us to close this session. So far, this COVID-19 webinar has been running for 3 episodes, and this one is our last. And what I would want to say is that what we have learned so far from the first and the second episode and the third episode, we realize how important our profession as radiographers and radiological technologists is in terms of providing quality of care and quality service to the patient in times of good normal practice when we don't have this communicable disease or this pandemic disease like COVID-19. But when we face with this kind of situation, we come together as a team of good friends, not only in each country, but around the world. And ISSRT is your representative, is your big home that we come together and work together for the benefit of our patients worldwide. So on behalf of President Donna Newman, and she is now also on vacation, but I know she's watching this, I would like to thank all speakers, Philip Jasson, all right, Reshma Mahipat from Trinidad and Tobago, Pichi Luna from the Philippines, Dialoshni from South Africa, and I wish everyone, all colleagues and friends around the world, please be safe, keep the good practice to help our patient, and that's our goal. When we help them, the people will know how important we are. And I am sure we're going to the stage that we are the frontliners because we really are. All right. Thank you very much for watching. And I hope you guys and everyone who is watching live session right now, you have a nice morning, nice afternoon, nice evening, and a nice day. Thank you very much and goodbye.
Thanks.
Bye-bye.
Bye-bye.
Bye.
Bye-bye.
Bye bye.
Goodbye.